Dr. Virdee, and I feel passionately about educating people about the impact that their diet and lifestyle can have on their health. My treatment approach blends the latest innovations in diagnostic testing with science-based, individualized treatment approaches that are specific to addressing the underlying cause of disease. The Women's Cycle Speaks video blog series is an exploration into the ways in which a woman's menstrual cycle and the symptoms that she experiences may be indicators of underlying nutritional imbalances. The symptoms are commonly seen and they're characterized collectively as PMS or premenstrual syndrome, and they include symptoms like acne, depression, anxiety, bloating, constipation, painful periods, heavy periods. And today we're going to be exploring painful menses and what they may be indicating. There are a couple of medical conditions that can actually cause symptoms of painful periods that would be important to treat if you're looking to resolve your symptoms. And some examples are hypothyroidism, endometriosis, and uterine fibroids. Be sure to talk to your doctor if you're experiencing symptoms of painful menses, as it may require treatment of the underlying medical condition. Many doctors just recommend utilizing painkillers like Advil and other NSAIDs, and that is helpful in the short run, but as you may have seen, there are studies that have found that these long-term use of NSAIDs are linked to infertility because they actually block ovulation or the release of eggs by the ovaries. So it's important to find natural therapies that are less invasive and work in synergy with our bodies. To give you a bit of a background, when a woman ovulates, her ovary will release an egg, and that egg will stimulate the production of progesterone. And the progesterone is what goes to the uterus and stimulates the growth of endometrial tissue. And the endometrial tissue is a lot like the earth outside, in the sense that if the egg were to be fertilized, it would implant into the endometrial tissue, and that's where it would get its nourishment as it grows into a fetus. Similar to planting a seed in the ground, and the ground is what nourishes it. When a woman isn't fertilized, the egg will eventually stop producing progesterone, it'll break down, and the spiral arteries are really cool. They're actually shaped like little spirals, and they're located in the endometrial tissue, and they sustain the delivery of nutrients into the endometrial tissue, and they're very sensitive to fluctuations in progesterone and estrogen. And right before a woman starts menstruating, she will have a sudden drop in estrogen and progesterone, and that will cause the spiral arteries to actually break away from the endometrial tissue through contraction. And the uterus itself will initiate the menstrual cycle because the endometrial tissue will no longer be nourished, and it will become basically dead tissue that needs to be released. So when the uterus starts contracting, that's when we start to experience menstrual cramping. And there is one key nutrient, prostaglandins, which actually stimulate the contraction of uterine tissue. And prostaglandins have the name prostaglandins because they were first found in the prostate gland, but they're actually found all over the body, and they're inflammatory markers that help drive inflammatory processes. So women who experience really painful menstrual cycles tend to have higher levels of prostaglandins, creating more uterine contractions and spasms. And this can manifest as lower pelvic pain, back pain, and the pain can be so significant that it can cause nausea and vomiting. One key nutrient, omega-3 fatty acids, which are found in fish as well as walnuts, really help combat elevations in prostaglandins. And I've seen supporting women who are low in omega-3s helpful in reducing symptoms of premenstrual and menstrual cramping. When I learn that a woman is struggling with painful menses, one of the first things I'll do is learn more about her diet. And some women who eat a diet that's higher in animal fats, like yogurts and cheeses and meats, they tend to have higher levels of prostaglandins, and many studies have found that increasing vegetable intake and non-meat forms of protein can actually help reduce symptoms of menstrual cramping and pain. Now, another reason why I think this happens is because a lot of dark green leafy vegetables, as well as fish, are high in magnesium. And magnesium is a nutrient that is essential to proper muscular function. And when people are low in magnesium, they tend to experience symptoms of muscle cramping and muscle tension. And generally, I'll find that women who experience PMS tend to also have premenstrual headaches, and helping to support healthy levels of magnesium either through diet or supplementation can really impact symptoms of menstrual pain. Be sure to like and subscribe to my YouTube channel, and I do offer complimentary consultations, so if you would like to talk about your specific health concerns and learn more about my approach to treating them, you can reach me at www.shalvaclinic.org or call 203-916-4600. Thanks for watching.